Well, 1 million Syrian children have spilled into neighboring countries. Lebanon, Turkey, and Jordan have taken the majority of them, and Iraq, too, has also seen an influx. Lebanon has the most, 800,000 in total, 400,000 of those children. 80% of these children are not in school there. Keep in mind that Lebanon's population is just 4 million, and so that means the number of Syrian school-age children could well exceed the number of Lebanese children. In Turkey, child refugees make up more than 50% of the 500,000 people the country has taken in. And in Jordan, there are almost 300,000 Syrian youth. 56% are not receiving any formal education. Now, statelessness is another worry. The UN estimates that every day 125 Syrian babies are born as refugees. A vast number do not have birth certificates. In the last year, just 68 babies born in Jordan's Zaatari camp received birth papers. Well, Peter Kessler is the regional spokesman for the UNHCR. He joins us now live from Amman. Peter, you've had plenty of experience around the world with these kinds of situations, but the Syrian crisis is particularly bad. What are the biggest challenges to providing help to children in these camps?
Well, what we've seen, of course, is that in the last months, since, of course, March of this year, there was a major influx of people across the region. The camps grew in size. The numbers in the camps of people are very challenging, 100,000 or so in Zaatari, 60,000 in one camp in northern Iraq. So, of course, it's a challenge getting the schools established and of course, providing the other needs, the counseling and the psychological support that the children need. But the problems are perhaps easier to address in camps simply because some 83% of the refugees are living in urban areas in Lebanon, Jordan, Iraq, Turkey. They're harder to reach. They're living in crowded apartments, perhaps camping in abandoned parking garages. They may not have access. They may not even be allowed out of their homes by their parents, who are afraid to draw too much attention to the fact that they're refugees living in the midst of an increasingly frustrated host community. So there are lots of challenge facing people in the urban areas, as well as the fact that many schools across these countries are already crowded with their own local students, even working on second shifts. So there's a huge challenge to be addressed in schooling, healthcare, and other community services that has to be addressed by aid agencies and other groups.
Sorry, if I could interrupt you just a second there. You mentioned healthcare, and I wanted to bring up this point about polio. We've seen this reemergence of this deadly disease, and in fact, last month, I think the World Health Organization confirmed the first outbreak of polio in Syria in 14 years. In fact, they've identified 17 separate cases of the disease, and now an estimated 500,000 Syrian children are at risk of contracting polio. So what is the best way to address this problem of a possible spread of a disease like polio?
Well, clearly there are healthcare problems that need to be addressed across the region. Syria had a very good health service in the past. Many people, children, were vaccinated, but obviously in recent years, in the last 3 years of war, that may have collapsed in some areas entirely. That's why, with the support of the host governments in Jordan, Iraq, Turkey, Lebanon, vaccination programs are underway. UNICEF has a major program together with the World Health Organization, working with ministries of health. And of course, aid agencies are working very hard inside Syria to get into all areas of the country, including besieged zones. But it remains a challenge across the region. And as you state, the children can be left out. And in that case, it put at enormous risk should they contract polio.